Ladies and gentlemen, it's my pleasure to give you my lecture here about my first experience with the Ray 1 EMV toric. And I will explain also a little bit the concept of the Arena EMV. I'm very sorry I cannot attend in person. Hopefully in the future I can travel to Kuala Lumpur and to Singapore. These are my disclosures. When we look at the Ray 1 IOLs, they are all fully preloaded. Here you see all the lenses that are available, from the enhanced monofocals, toric, standard lenses, trifocal toric, so everything is listed here. The Reina injector, I think it's an excellent injector. We tested this in the David Apple lab several times, so we are very happy with that. You get the lens in the usual range between 10 and 30 diopters in 0.5 diopter steps. The cylinder is available in 0.75 diopter steps, as you can see here, from plus 0.75 up to plus 4.5 diopters. And here is the entire family. The Ray 1 EMV lenses were launched last year, and the toric version as well, and introduced at the meetings there. So the extended range of vision with the Ray 1 EMV is around up to 1.5 diopter with ametropic target, but you can increase that with monovision type of things. It's a non-diffractive IOL, which has of course very good contrast sensitivity, no dysphotopsia, and because of the positive spherical aberration it is inducing, it provides a much smoother transition between distance and near eyes, you have to say that. And it's also available now as a toric lens. So the positive spherical aberration create this kind of 1 to 1.5 diopter defocus range, which is very important, especially also it's going on around the hyperopic range. So this is a typical defocus curve you have here, and you see how broader this is. As I said, also number 3 here in the hyperopic range, as well as number 2, as you can see here, in the myopic range. So we can take advantage of this for better landing zone, but also for combining this in a binocular fashion, especially with a monovision type of thing. And when we look at the monovision type of thing, there's a kind of nomogram, how you can do that with this offsetting here, as you can say. And you don't need to get away from each other so much. Half a diopter, more or less, is enough. Maximum 1 diopter, which gives you almost 2.5 diopter of defocus, because the curve is so big in both directions. So here you see again this setting. If you go to 1 diopter, you get easily to reading distance here. So here you see the ametropia target. I have a nice patient example here of a Ray 1 EMV toric version. This is a 64-year-old female. You see here the visual acuity, and also that she has an 1.5, almost 1.5 diopter astigmatism in both eyes. This has been calculated with the calculator from Reina, and these lenses have been identified, as you can see, for the right and the left eye. First surgery was done September 22nd last year, the first one in Germany, or in the German-speaking area, as you can see here, using the APAO microscope and everything. And these are sequences from the surgery. The surgery video is too long to show here in the short movie. And you can see here, before we left the eye, how good the centration was. Very first day outcome was excellent. Uncorrected visual acuity of 0 logma, even better than 0 logma. Patient was very happy with that, as you can see here. So here we see the follow-up after 1 week post-op. You see excellent outcome, distance acuity minus 0.2 logma, and very good intermediate and near acuity. After 1 month, near acuity even became better. Some fluctuation after 3 months, near acuity was a little bit less. But now after 6 months, better than 0 logma in all distances, and appropriate defocus curve, as you can see here, gives you an idea how excellent this lens performs in this condition. So we are very happy about the outcome here. Also the stability of the toric lens of both eyes, as you can see here. The patient is very happy. Even in the near, she can see more or less very, very nicely 0 logma or 0.1 logma. Occasionally, depending on the light, she's using some spectacles for the near, but very, very rarely. So she's very happy, and we were very happy to be the first in Germany last year to put these lenses into the eye. Well, when we come to the conclusions, we can say that the Ray 1 EMV and toric version really offers a very nice increased range of focus of like 1 to 5 diopter, especially when we just look at the ametropic target. If we do mini monovision or something like this, we can go up to 2.5 diopters. The toric version is a very good new IOL with very good rotational stability, similar actually to the Ray 1 toric, the normal lens, and very good concept here, I have to say. The IOL power calculation and implantation and so on is all uncomplicated. There's no big secret here in that. And the very first one in Germany is such an overwhelming excellent results, almost unbelievable, but it's a true value, and I just saw it today actually for the 6 months follow-up. So long-term, of course, follow-up is very important here, but I think we have an excellent platform here on non-diffractive basis, which will help our diffractive patients, our refractive patients very much. So thank you very much for your attention.